The core principle that drove me in starting the organization is still the core principle that drives the organization now, and that is the one person at a time approach. The traditional providers struggled with, well, we don't do things that way.
Other providers will take a single psych eval and meet the person one time for a half hour. They'll put together a 2-page treatment plan and then admit the person.
Because some organizations just use kind of a canned approach. There's a certain program that you have that people fit into.
If I can't get anybody else to do it, then maybe I just need to show them that it's possible.
I think the main part is Ruth's commitment to really improving the lives of people with disabilities.
I think what we've established over the course of the past 20 years is that not only will we support anybody, we will support anybody very, very successfully.
We really care about people as people and want them to develop a vision of their life that's meaningful.
What their vision is what's important to us. And then we kind of couple that with innovation and changing how we deliver service.
There's not a lot of agencies or providers that can do what we can do for people.
We try to determine what the person is communicating through their behavior. And if we're able to help figure out what they're communicating and what their underlying needs are, then their behavior changes as a result of that. But it's a change that comes from them, comes from within. It's not driven by us.
We work with people and we say, what do you want? What kind of life do you want to live? Who do you want to be in the world? We look at the barriers that people face in trying to be able to have that experience in life, a meaningful, rich life, and we work on helping people overcome the barriers.
We don't talk for people, we talk with people and find out from them personally what matters.
That individual has a big say in every aspect of the process, including finding a house. It's all about where they would want to live.
InVision Human Services provides a variety of services. The first one is our BHRS program, which is Behavioral Health Rehabilitative Services. It's a program that is designed to support children in their families' homes. The other service is our Community Support Services, and it is also a service that provides one-on-one support to children and adults in their home or family setting. In that program, it's not behavioral driven. We can provide whatever type of supports a person needs.
We have an extremely unique summer therapeutic program. The children just have so many smiles on their face. They're so happy to be there. They come day after day. And with no exclusions, we really allow children who may not have opportunities elsewhere to come to our camp and get immersed in the community.
The clinical consulting service at InVision. Basically what I do is help people who are pretty much in desperate need of finding someone to provide a service to folks in the community who have either been failing in service or who are on a bad path to maybe not being as successful as they could be. We do that very thoughtful process of looking at what are the risk factors and is this person getting better? And we're able to really outline how that person is getting better to justify reduction of supervision. And that's giving a person a life.
There are two separate programs that make up our residential services. One is called Comprehensive Living, which provides a variety of supports which are highly individualized based on the needs of the person. And the other program is the Signals program. Signals provides the same type of supports but has additional supports in place for people with problematic sexual behaviors.
Within that, we do what we call risk management, where we're actually looking at the individual and problematic sexual behaviors that could increase risk to them and the community. We're in the business of motivation. And if we can keep people motivated and encouraged while simultaneously helping them to identify and manage their risks, people can accomplish just about anything.
Our employment supports program focuses on looking at very specialized approach to helping people get real jobs in real communities with real pay. We're looking at people who would never have the opportunity to explore that otherwise.
Philosophically, we see growing InVision as a way to establish stability. And in establishing stability financially, you're establishing stability for your philosophy. And we really feel that if we're doing one, we're doing the other.
Early on, we had contracts with only 3 counties in southwestern Pennsylvania, and by the time we hit our 15th, 16th, 17th years, we were up to 25 counties, which is half the state of Pennsylvania.
People across the state have really grown to understand that we have a very, very unique way of providing supports to people.
This is a field, like most, where things are always changing, where we're always learning more, where we have the opportunity to become better and better and better. We have to look at ways that we can impact more people.
One of the things I'm really excited about is that I think that this company has the potential to be a real teaching influence within the larger behavioral health system.
I think one of the most rewarding aspects about working with InVision is that every day I come to work, I feel like I'm making a difference.
I think another great thing about our company is that we create environments that they can succeed in.
That doesn't really sound like work to me. That sounds like helping someone have the life that they want to have. So it's a lot of fun.
It's nice to be a part of watching that unfold.
I think that one of the things that unites many people in this organization is the commitment to see all challenges as opportunities.
If you or someone you care about needs support in order to fulfill the vision of his or her own life, please call InVision Human Services at 412-456-2144 or visit us online at envisionhs.org.